Hello, doctor. My name is EshikaParuchuri, and I'm studying 11th grade at the Woodbridge Academy Magnet School in New Jersey. I would like to begin by thanking you for joining me in this initiative. My main objective is to educate and empower adolescents around the world to help them construct a healthier lifestyle. And by working with experienced doctors across different specializations around the world, I aim to promote health education and hope to inspire many teenagers who want to pursue careers in healthcare and medicine, not just as future leaders, but as individuals prepared to respond to urgent public health challenges, from everyday medical needs to global crises like the COVID-19 pandemic. Welcome to the Healthy Teens podcast. I hope you are keeping well. I'm joined by Dr. Siva Kumar Kotra, who specializes in orthopedics and sports medicine. He has vast experience in this field as an orthopedist at care hospitals in Hyderabad, India. He has over a decade of experience and expertise in procedures like joint replacements, arthroscopic surgeries, sports injuries, and ACL reconstruction, to name a few. And for this episode, we'll be focusing on general orthopedics, public health issues, and many other factors that play into healthy living that concern teens. And now, Dr. Kotra, can you give us a little background regarding your experience in this field?
Hi, Eshika. Nice talking to you. Thanks for inviting me to this podcast. For the audience, I'm Dr. Siva Kumar, arthroscopy surgeon, trained in arthroscopy, sports, and ligament injuries as a subspecialty of orthopedics. So I'm into orthopedic practice for more than a decade, around 12 years right now. And I was trained at the Osmania Medical College, Hyderabad in MBBS. Then I did my post-graduation at Satya Sai Institute, Puttaparthi, in National Board of Examination, through National Board of Examination. And then I practiced general orthopedics for around 3 years before I went for my advanced training in arthroscopy, sports and ligament injuries. I was trained in sports and ligament injuries at Coimbatore in an institute called Ortho-1. So that's where my life turned around because I was trained by the world leader, Dr. David Rajan, who is a legend in this field. And I've been focusing more on arthroscopy, sports, ligament injuries, and joint preservation since then. So almost since 2017, I'm into joint preservation as a subspecialty of orthopedics. So that's where I stand. And I'm very happy to join you. So
Wonderful. That's a very nice background. And I like that you were able to understand that you had a very big passion for arthroscopy in particular. Okay, so let's talk about public health first. Are there any lifestyle changes that people can make to prevent orthopedic issues?
yeah, the common things which we suggest to the general public is to give some time for your fitness, because joints is about mobility. So the mobility comes in three different aspects. One is the cardio, which is the basic thing like jogging, walking, brisk walk, cycling. And then comes the stretching exercises. You need to stretch your joints like they do in the yogasanas, okay? And any kind of stretching program for that matter is useful. And then comes the strengthening, some weight training. You can do weight training at home, you can do weight training at gym. But these are the three different components of your fitness. Most people tend to focus on only one aspect, leading to problems, or neglect all three of them. So there should be a right balance of all the three.
Oh, okay. And are there things that people commonly do that make their joints or bone problems worse?
One common thing, just like I mentioned before, some people go to the gym and do only weight training. They focus on building their muscles to show off. Basically, that's to show off. This especially happens with the teenage boys.
Yeah.
But the problem, as I mentioned, it creates too much of pressure on the joints. So, for example, if you start doing only the upper body workouts because that's what they want to show to the girls. So, the shoulder joint especially takes the load and it gets damaged significantly. Sometimes it goes for surgeries. We do ligament repairs as well because of that. So, it should be a balanced thing. You need to do some weight training, you need to do cardio, and you need to do stretch a lot. You need to stretch a lot. If you have to choose between these three, stretching should be given more priority than other things. That's where people do wrong.
Okay. Are supplements like calcium effective for joint health?
Yeah, this is a little controversial topic. A decade or two ago, the calcium supplements have been suggested as a panacea for all the orthopedic problems. But what we realized of late with latest research and inputs from practical experiences is that not everyone needs a calcium supplement. We basically need three different kind of things as a supplement for us. And the most important thing among these three, first one is vitamin D. So vitamin D comes from sunlight naturally, but some of us may not have the right kind of hormones in the body to harness the sunlight. So we might need vitamin D supplements after checking our vitamin D levels. Second is calcium and phosphorus, the major minerals. But the catch here is calcium and phosphorus or all these kind of major minerals are available in all the foods, almost all the foods. We don't need special supplements for these major minerals like calcium and phosphorus unless we are malnourished, unless we are sick and we are not able to eat, or unless we are not able to digest our food properly because of digestive issues. Usually for general public, we don't need calcium supplements. What we need is vitamin D, and what we need is the third thing, that is micronutrients. And most of your daily micronutrient dose you can get from fruits, vegetables, and some sprouts.
Okay.
So these are the three aspects of a bone health, and calcium is overhyped. So it's not mandatory for general public. It's only for a specific group of people. But the other micronutrients and vitamin D are recommended for most people.
Oh, okay. And aside from exercise, what's one other thing you wish more people knew about maintaining bone and joint health?
Definitely a balanced diet, like I was just mentioning. You get micronutrients, B12, vitamin D, and calcium related things from your diet. A balanced diet is what is needed. We don't need crash diets. We don't need magical diets. We don't need the keto diet. But it should be a balance of carbohydrates, proteins, minerals. Basically include lot of veggies, lot of fruits. It can be the same vegetable, you might like only one vegetable in the whole world, but make sure you continue taking that vegetable on a regular basis. It's better to diversify always, but make sure you don't miss out on vegetables and fruits citing whatever reason. So that is one, diet. And second thing is sunlight exposure. Most people underestimate this. They tend to feel that sunlight causes cancer, sunburn, and all those things. But unless you are exposed to very harsh sun, any kind of mild to moderate sunlight is good for your health. If you have fair skin, you can minimize the sunlight exposure. If you're dark skinned, you need more sunlight exposure. The average is around 15 to 20 minutes for light skinned, mild sunlight of 15 to 20 minutes for light skinned people, and mild sunlight of 30 to 45 minutes for dark skinned people. It ranges, but so sunlight, diet, and exercise. These are your three, what you say, doctors as far as the bone and joint health is concerned.
Oh, okay. So it seems that it all goes down to diet, exercise, and maintaining that balance.
Right.
Okay. And now let's talk a bit more about adolescent and young adult health. Among some of the patients that you might see in a day, what are the most common sports-related injuries you see in many young adults?
As a teenager, everyone loves to play sports, and in our population, at least in India, I guess it will be more or less the same all over the world. We see two categories of people. One is the one who is very active and wants to go to the sports. He abuses his joints too much. He doesn't do training properly and goes to the sport. There, he damages himself, he or she. There is the second category who tend to avoid sports altogether and sit on their mobile phones, iPads, tablets. Basically, the one who is glued to the electronic devices. So these two are the extremes. We don't want to go to the extremes. You need to have some physical activity, but you need to have a proper training before you go to the sport. If you need to, the common sense says that if we want to play an aggressive sport for 1 hour, a professional sports person needs at least 4 to 6 hours of training to play 1 hour of sport. But for a recreational player, at least 1 hour of training is needed to play 1 hour of sport. So if you want to play 30 minutes of football or cricket on your weekend, you need to do 30 minutes of basic exercise in the weekdays, the whole week. Only then you are eligible to play in your weekend or whatever. So that's where the problem starts. And having the right kind of balance, just like we discussed, having good food, especially teenagers crave for junk foods. So there they tend to miss out on the nutritional value of vegetables and fruits. Find out some way of making your vegetables tasty. You can add your lot of veggies in your burger. You can add a lot of veggies in your pizza, and try to have more of salads. So that's what keeps you healthy as a teenager.
Going back to the point where you mentioned you need extra time so that you are eligible to play for 1 hour, 2 hour. Is during that time that you prepare, how does stretching help? Like, what would happen if someone just went in and play without doing any prior exercise or stretching beforehand?
Basically, we must understand that sports is an abnormal kind of activity, not a routine activity for the human being. The routine activity is the walking. Some basic weight training is okay. If we look at the animals from which we have evolved, you look at the monkeys, okay, they do involve in some kind of weight training, some kind of cardio and all. But sports is taking it too aggressive. Before your teenage starts, you can do any kind of sporting activity without much training, that's fine. But as you enter the adulthood in your teens, you tend to damage your ligaments if you play too much of sports without training. You need to have that basic conditioning before you jump into sports. It's a big subject, but as discussed before, again, you break down the fitness into three parts: the cardio, the weight training, and the stretches. These vary as per your sport.
Oh,
A footballer, a footballer needs more energy in his lower limbs, whereas a shuttle badminton player needs more energy in his upper limbs.
yeah.
Not always same, but the predominance changes. But all the sports need something called core strengthening. Core is like the central part of the body, the abdomen, the back muscles, and the side muscles. So the core has to be strong, whatever game you are playing. So do a lot of core strengthening, and then you can avoid your ligament injuries. So you have ligaments all around the joints. For example, a shoulder joint has got ligaments in the front, ligaments on the top, ligaments in the back, ligament in the sides. Any one of the ligament can get damaged easily if you are not trained enough. I can give an example. In India, especially, we play a lot of shuttle badminton.
Yeah.
In shuttle badminton, people tend to play a smash shot, something called smash shot. Okay, so the smash shot is where you hit the shuttlecock hard onto the ground of the opponent. For this, you need a lot of strength in your shoulder. But not only shoulder, there is involvement of the elbow, there is involvement of the core muscles. The right technique of playing a smash shot is that you jump in the air, you arch your back, you bend backwards, and at least 30 to 40% of the power of the smash shot comes from your trunk muscles, the muscles of the back and the muscles of the abdomen. So your whole body should be strong. You should be agile enough to jump in the air and again land properly.
Yeah.
People think that if my shoulder is strong enough, if my forearm is strong enough, I can play a good smash shot. But no, you need to have good strength in your core. You need to have good balance so that you land properly. So I would have operated at least 100 to 150 teenagers who had shoulder injuries as well as leg ligament injuries after a smash shot, because they tend to land wrongly, because they don't have that strength or balance in their lower limbs. So they tend to land in a wrong position and tear their knee ligaments, commonly ACL ligament. So apart from technique, you need to have a overall conditioning of the body, or else you tend to get a lot of injuries. If you don't have time for all these things, I would say skip sports. Just do some cycling, do some swimming, do some yoga, some brisk walking or jogging, and you'll be fine. Why do you want to damage your body for extra fun if you don't have that diligence or time?
And can you explain some signs or symptoms of a torn ligament or tendon?
It varies from joint to joint. Let's discuss about the common things. One is you will be having a lot of swelling, pain, and sometimes instability. The joint tends to become loose. You tend to feel that the joint is loose and you are not confident in doing any kind of aggressive activity. A special catch in ligament injuries is that after a period of rest, maybe 1 or 2 days of rest, you will be able to move the joint. You will be able to walk around. That doesn't mean you don't have a ligament problem. For example, you had a knee injury, you had severe pain and swelling for 1 or 2 days, you took rest, your x-rays were normal. That doesn't mean you're fine. After 2-3 days, you might be able to walk, you might be able to climb stairs, but you will continue to have that nagging pain, that lack of confidence. For example, when you tend to run or when you tend to have any jerky movement, then you realize that there is something wrong with the joint. It's not confident, or it tends to slip. Sometimes the joint tends to slip. you tend to fall down because of that instability. That's when you must realize that something is not right, and you need to get an MRI scan to see the ligament tear. It's not seen on X-rays. Sometimes it is the doctor can check and find out, but sometimes even on clinical examination the doctor might miss. So hence your doctor, orthopedic doctor, recommends for an MRI scan when he suspects a ligament injury, and don't hesitate to get it done, because that's where the real problem comes out, and then we can plan accordingly.
Mm. Okay, so now we'll shift to talking about general orthopedics and sports medicine. Can you tell us about your journey into orthopedic medicine?
Oh, my journey into orthopedics.
Yes.
Yeah, that's going to be interesting. I always wanted to become a I would say I was never into becoming a doctor, but I was fascinated by biology.
Mm.
In my 10th grade, I decided that I'll be sticking to biology. And once I took the biology, I realized the doctor's profession is the most noble and what to say, most successful profession. But I was not sure what specialty of doctor I would become. But I was definitely liking the subject of studying the human body. At the end of my graduation, I had to decide to which specialty I have to go. And then I was actually having some fear about surgeries. I was not sure if I can do surgeries. I was a good physician for sure. But then I saw that I joined the surgical branch, and I was not very sure. And then I came out of that branch. But somehow I had that thing that no, I should become a surgeon because that gives more satisfaction.
Yeah.
And in surgical branches, orthopedics, why orthopedics? Because uh, I like sports a lot that time. And I saw that some of my friends who were into sports, they landing up in ligament problems, and they got very well after orthopedic surgery, and they were very happy seeing the result, and they went back to their sports. So somehow these things motivated me to become an orthopedic surgeon. And though I had some fear in the beginning days, I made sure I over I overcame that fear, and then uh, it took me along.
Very nice. What would you say was the most challenging part in your training for orthopedics?
Most challenging part of training for any doctor, for that matter, is the uh, during our post graduation, we call it residency. During our residency, we tend to have the night calls and holiday calls, and absolute there is no leave. You tend to work 24/7, 365 days in a year, and that's a little tricky thing. But as you love the journey, you tend to enjoy it, because only then comes an opportunity for you to learn.
Yeah.
That was a little tricky. Sleepless nights on the night duties and holiday calls. But that also the flip side is we get more chances to learn. We get to do minor surgeries during those night calls, because the senior doctors are not available at night calls. So we junior doctors, training doctors, get a chance to learn, of course, under the supervision of one of our seniors. But that's what is the tricky part of it. We enjoyed all those things.
Very nice. And right now, as a established doctor and surgeon, what are some of the common conditions that you treat on a day-to-day basis?
Uh, we basically treat problems of I would say three types of problems. One is the fractures.
Mhm.
Fractures is the basic things which every orthopedic doctor treats. We have the minor fractures which get treated by plasters, and the major fractures which get treated by surgeries. And then we tend to get the joint and ligament problems.
Mhm.
The heel pain, starting from the heel, a heel pain, knee pain, calf pains, pain in the hip joints, pain in the spine, the lower back, the mid back, the upper back, and the neck. And then all the joints of the upper limb, like the wrist, elbow, shoulder. And again, in the joint problems, we have two categories. One is the young joint, where we get a lot of ligament problems, ligament tears, and the uh, joint problems in the elderly population. The senior citizens, they tend to get degenerative joint disease. We call it degenerative arthritis
Mhm.
or osteoarthritis. So those are the problems which we tend to treat with joint replacements and all. So these are the three categories of fractures, the young joint problems, and the senior citizen joint problems.
Okay. And among the many cases that you may have dealt with in your experience, can you share one interesting case that you had dealt with?
Uh, I have quite a few experiences, but
Yeah.
I would like to share two of them.
Okay.
One is a professional basketball player. He came to me as a teenager.
Mhm.
He had his ACL ligament and his meniscus. The meniscus is the shock absorber of the knee. ACL is the most important ligament of the knee joint. He tore both of them while playing a basketball, and we operated him like we do for everyone, and we gave a very strong ligament back, and we gave a very strong shock absorber back. But we were not sure whether he will get back to his sports or not, because
Mm.
as we all know, once out of sports, it is not easy to go back to sports, because you need to uh, condition your joint again to such a high level performance. He was a professional basketball player. He played for the state team of Andhra Pradesh that time, and then he played the nationals as well. But that guy had a lot of resilience. He followed all our instructions strictly, which most people don't follow. Uh, he had a rigorous training program, 2 hours of training in the morning, 2 hours of training in the evening, right from the second month of his surgery. And he followed this regime strictly for 1 year, and he went back to play the nationals.
Oh,
He
wow.
was a very successful basketball player. We were actually surprised with his resilience, because we operate the same for everyone, but not everyone has that resilience to go back to his pre-injury level. And we conducted an exam for him. See, we conduct a sports test for him, whether he is fit to return to his competitive sports or not. He passed that test. We testify that this guy has completed his training following the ligament repair, and now his ligament is good enough for playing competitive sports. He did that. Otherwise, if he doesn't pass that exam, we would certify that his training is not adequate, and he might tear his ligament again. Very high chances. So that's what we say. He passed that. That was one thing. And second case was uh, she was a homemaker, a female, middle-aged female, around 35 years. She had multi-ligament injury. She dislocated her joint completely, and all the four ligaments of the knee joint were torn. We repaired all four of them in the same sitting. We were not sure how much she would recover. because she is not much into physical activity before the injury.
Mhm.
Uh, she was not into sports or she was not into fitness. We were not sure how much she would recover. But we told her, you need to do some fitness activity for the next 1 year. And she also did diligently. And she was up and about within 3 months. 3 months, she got back to her daily life. With all the four ligaments of the knee gone, it's not easy. So these are the patients which sometimes inspire us to do more, uh, inspire us to do even better.
Mhm. And do you think that this patience is very important in the process?
Yeah. For all the health problems, you need to have the patience to follow the instructions of your doctor. But more so with the sports and ligament injuries which happen in the teenagers, you need to follow those training sessions properly for 1 year. 1 year is a huge thing for a teenager. A teenager wants to jump back to his sports as soon as he is up and about, but he has to control himself. So it's all lot of mental balance as well.
Very nice. Okay, so now let's talk a bit more about what you specialize in. We talked about how you were an arthroscopic surgeon, but what exactly is arthroscopy and when is it used?
Arthroscopy as a subspecialty of orthopedic department has basically evolved from the demands of the sports persons.
Mhm.
It all started around 40 to 50 years back, whereas the orthopedic department was there since centuries. But the sports injuries has developed as a subspecialty because of the technique of arthroscopy. Arthroscopy is basically looking into your joints with a small incision. Put a small stick inside with a camera at the tip of the stick, and you look at the whole joint on a monitor and tend to repair the ligaments inside the joint without the need for opening up the whole joint. We just open only a small part of the joint. We make a small keyhole incision, and then we repair the ligaments and shock absorbers inside the joint. This developed as a specialty from sports injuries, but uh, the application of arthroscopy also extends to the road traffic accidents,
Mm.
especially in countries like India, where there are a lot of two-wheelers. Two-wheeler is the standard way of transport in India, and because two-wheelers tend to crash, they tend to slip. So we have a lot of twisting injuries of the joints in India, almost 50-50, 50% of sports injuries, 50% of two-wheeler injuries. Whereas in some of the Western countries like US and all, it's 75% of sports injuries, 25% of two-wheeler injuries when we deal with arthroscopy. But so arthroscopy has got its role to repair the ligaments and meniscus in sports as well as road traffic injuries. So here the advantage again, because it's a keyhole procedure, the recovery is very fast, the pain is very less. Unlike a fracture or a joint replacement where the patient needs significant amount of rest to go back to his activities, arthroscopy allows the patients to go back to their activities as early as 2 weeks or 3 weeks of after the procedure, and we make them walk the next day of surgery. As a policy, the movement will start next day after surgery in arthroscopy.
Okay. And with that, we will be moving on to our last section, which will consist of some mythbusters. I'll be reading some common myths related to orthopedics, sports medicines, and let's see if they're myths or not. Number one, oh, this is an interesting one. Cracking your knuckles leads to arthritis.
No, cracking your knuckles doesn't lead to arthritis. There are special situations where your joint is already damaged
Mhm.
due to an injury, due to an infection, or sometimes due to an inflammation. We call it the inflammatory arthritis, like rheumatoid arthritis. Only in those cases, we need to avoid this. But in general public, it doesn't cause any problem.
Okay. A broken bone means you can't move or bear weight.
A broken bone doesn't always mean that we need not, it doesn't mean that you have to rest it completely. With modern technology, we can make the patient walk or move their bone immediately after injury, either in the form of proper plaster application or in the form of any minor procedure. We tend to fix the bones and make them walk the next day of the injury. This happens very commonly nowadays. In the olden days, when the demands of excuse me, when the demand of human beings were less, there people used to treat the fractures with bed rest. But nowadays, it's not like that. Now, the technology has become so advanced that all your uh, fractures can be mobilized the next day after the injury with proper treatment in most cases, in at least 95% of the cases. There are some very bad fractures where, in spite of a surgery, in spite of plaster application, you need to rest for a month or so, but that's very rare. Most of the fractures, you can go about your basic works, basic activities the next day of the injury.
Okay. If something's wrong with your bones or joints, surgery is unavoidable.
Not always, as we just discussed. Whether it is the fracture, whether it is a ligament injury, the sports injury, or whether it is an advanced arthritis in the old age, in the senior citizens. In all the three cases, we always have non-surgical options. That again depends on case-to-case basis. I don't want to go into the details, but I just want to tell one point. Most patients tend to get confused by looking at the internet.
Yeah.
That the same problem gets treated with surgery in the hands of one surgeon. The same problem gets treated without a surgery in the hands of another doctor.
Yeah.
That's where people get confused. What I would recommend is, whether it gets treated with surgery or without surgery or with a minor surgery, let your specialist decide that. If you have a doubt, you can always take a second opinion on that. But the doctor will decide based on many factors, not just one factor. An ACL tear in a young person is treated surgically. An ACL tear in an old person is treated without surgery, because the demands are different, the requirements are different. But whatever we do as doctors, if the patient follows certain basic guidelines, like we were discussing at the beginning of our discussion, the three aspects: your diet, a healthy diet, good exercise program, which includes stretches, cardio, and weight training, and then good sunlight exposure, good sleep, of course. If you are conscious and careful about your lifestyle, whatever the doctor does, his treatment will be successful. Don't think too much about what the doctor has to do. Let the decision be taken by the doctor. You can have second or third opinion if you don't trust the doctor. That's different. Patients tend to overthink about what the doctor has to do rather than what I have to do. So it is 50-50. Half of the problem is solved by the doctor with his expertise, and half of the problem is solved because of your following of the instructions and your lifestyle correction. So please focus on your 50% and let the 50% be taken care by doctor.
Okay. And next, rest is always the safest way to heal an injury.
Rest is good after any kind of injury, whether it is, sometimes you don't know whether it's a fracture or a ligament injury. Yes, definitely you need to rest for the initial 1 or 2 days. But after 2 days or 3 days, if based on your doctor's opinion, it's not always rest. For example, it's easier understood if I give you an example. Imagine the most common ligament injury which we all see, an ankle twist. See, we all would have twisted our ankles at some point of our life. An ankle twist will lead to ligament injury of the ankle. What we need to do? Yes, definitely we need to give rest for the initial 2 to 3 days. And after 3 days, we need to start doing basic exercises. There are some basic stretching exercises recommended for the ligament injury to heal. We can walk around with a support. We call it an ankle support or an ankle binder. So with a support, we can walk around and do the basic stretching exercises as per the suggestion of the doctor. What most people tend to do wrong is either they're too aggressive with their body. So they say that I don't want any rest. I just want to jump into the sports. They continue to play aggressively the next day after the ankle sprain. That's one category. That's also wrong. There is a second category who have a lot of fear. They tend to give up everything. They just want to lie down on the bed for a month because they feel that the ankle problem can get aggravated. Both are wrong. You need to have a balance. You need to do some controlled movements as per the doctor's suggestion and sometimes as per the suggestion of your physiotherapist. The doctor will refer you to a physio. That physiotherapist will guide you into what to do, what not to do. And you need to do those basic activities to get back to normal. Otherwise, what will happen is your muscles will become too weak. And at the end of 1 month, your ligament would have healed, your bone would have healed, but your muscles have become so weak that you tend to limp up to 3 months or 6 months. And that limp continues for a long time and leads to abnormal gait pattern. So you need to have the right balance. It's not always rest. It is rest with limited activity with guided exercise program. That's what gradually, you need to go back to your sports also gradually. Another common mistake is they give rest for 1 week or 2 weeks and the next day they jump to the sports. So they have been waiting to jump to the sports. But that's not how it works. 2 weeks of rest, 2 weeks of basic exercises, and then another 2 weeks of sports level training, and then only sports. It's a gradual return to sport. So that's what we need to do.
Okay. And lastly, what are your thoughts on how the field of orthopedics has evolved within the past few decades? What do you think has changed most from when you first started working in this field to now?
Two major things have happened. One, all the surgical procedures have become more sophisticated. 2 decades ago, the surgeries which were happening were fraught with some fears, some complications, and all. But now the techniques have been refined so perfectly that the complication rate has come down significantly. And more importantly, the surgical techniques have evolved into minimally invasive things. So there are no more major cuts. For example, if there is a broken bone here, previously we used to cut open and fix them. But now I'll just make a small hole here, and just, it's all minimally invasive nowadays. It's all minimally invasive. And particularly in India, previously, the advanced imaging methods were not available. For example, the MRI scans were not easily available before. So we tend to miss many problems like the ligament tears, the infections, the tumors were missed before. But nowadays, with the latest imaging available, and it has become more affordable also. The imaging has become more affordable. We are able to detect problems at an early stage and guide the patients accordingly. So we are in the best phase of the medicine, to my knowledge, and I think we should start valuing our health better because of all these privileges. No more complaints. You cannot complain anymore.
Yeah. Okay. And with that, our podcast session has now come to a conclusion. Thank you once again for your time, input, and contribution. And for our listeners, don't forget to, it's okay.
Nourish your habits to flourish your life.
Thank you.